Good morning, good afternoon, and good evening, depending on which part of the world you are located in. Am I audible to everybody? I hope so. If there is some problem with the sound, kindly put it in the chat box. I hope I'm audible to everybody. My name is Asim Prakash. I'm a faculty at the School of Public Policy and Governance, Tata Institute of Social Sciences, Hyderabad. It is my pleasure to welcome all of you to the Perspective Lecture Series. As many of you might be knowing, since the past couple of months, the Perspective Series is engaging with several critical issues raised by the pandemic COVID-19. In several of previous lectures, our guest speakers have often explored the intellectual foundations to reimagine the socio-economic order post-COVID, or perhaps have engaged with the critical issues which all of us are experiencing. We had certain very lively discussion in the previous months, ranging from restoration of the work and informal sector, institutions and international political economy, reimagining public health and public health systems, fostering humanness, and so on and so forth. Today is the 65th edition of our Perspectives. We are very glad to welcome one of the foremost sociological thinkers and anthropologists of our time, Professor Veena Das. Welcome, ma'am. It's an honor to host you. Professor Das is currently a professor of anthropology at the Johns Hopkins University. Before her current stint, she has been a faculty at the New School University, Howard University, University of Chicago, Amherst College, as well as our own Delhi University, the Delhi's famous Delhi School of Economics and Sociology. Her writings are well known to us. She has contributed seminal work and articles in host of peer review journals on issues ranging from health, disease, poverty, violence, and ethics. Her latest work, published in 2020, is entitled Textures of the Ordinary, Doing Anthropology After Wittgenstein. Earlier, Professor Das had some very important contribution on violence and social suffering, and was one of the pioneers to bring the issue of violence within anthropology of South Asia. While wearing a hat of anthropologist and a social thinker, Professor Das is currently initiating a multi-country study with colleagues from several universities on effects of COVID-19 on vulnerable households in order to research how short-time crisis can fold into a long-term spirals of porosity. We are very honored to welcome you, ma'am. We'll start the session in a couple of minutes. Just some housekeeping announcement before that. I'll let everybody know that this session is being video recorded and will be available on our web channel subsequently. Now a bit about how we have structured this session. So Professor Veena Das was very keen that this should not be a lecture mode. So it should be much more interactive as much as possible. So what we decided that the session will be divided into thematic tracks. There are 3 tracks which we are going to decide the session on. The first is science and public policy. The second is democracy and authoritarianism. The third is forms of solidarity. After each sub-session or the track, as we say, the participants will be invited to ask questions or give a very brief comment. What we will request you to raise your hands, and if you are not able to raise your hands, kindly raise your hands by the digital option given you in your Zoom browser. And if you are not able to do so, kindly write your questions in the chat box, which we will relay to Professor Veena Das. I will request all of you to kindly be very brief in your question and comments, so that as many people can get a chance to interact. So here now we are going to start, ma'am. So the first session is on science and public policy. Now, within the post-COVID era, science has acquired the center stage, and so has public policy. So the main question which we are trying to understand from you is, how should public policy take into account the various kind of scientific uncertainties? It can be about vaccine, it can be about cure, it can be about asymptomatic patients who go, when they go for a vigorous testing, they might lead to false positives. There can be so many issues which the uncertainty comes, and public policy has to engage with that. So how should a public policy take into account the scientific uncertainty? Second question is, within the same track, is how do social and economic inequalities affect the implementation of policies? As we all know that the the lockdowns does not affect similarly to everybody. So how do socio-economic inequalities affect it? The third is implementation to be thought of as an external to the modeling exercise. Just to give an example of this is for instance, somebody was telling me yesterday that in a train which goes from various parts of country and reaches Hatia, that is Ranchi, 128 births have been delivered on the train itself. So the question is that whether the modeling, the data, pandemics of data which we are seeing around, everybody is an expert, everybody is giving different projections. So is implementation, when it is implemented, the policies when they're implemented, are they external or internal to these modeling exercises? So with these three brief questions, we start the first session. Thank you so much. Yes, ma'am, over to you.
Okay, thank you very much. I hope everybody can hear me. It's a great honor to be here. And as I'm looking at all your greetings from different parts of India and some people from different parts of the world, I have to say it's just really fantastic to be able to discuss some of these very, very difficult issues which have come before us and which require a certain kind of patient disposition to think through this. And crises are not often the kind of occasions when, you know, everybody kind of gets panicky and everybody wants to have very quick solutions. But what we are faced with is enormous scientific uncertainty over here. And I should start by saying that this uncertainty is partly because of the fact that we have a new virus, but it also results from the fact that there's been a kind of, I would say, a singular failure on the part of governments to prepare themselves to be able to deal with a new pandemic. This is despite the fact that the questions about preparedness in relationship to a pandemic have been, you know, they've been around forever. There have been scientific controversies around it. There have been earlier ways of learning how to handle things like Zika virus in Brazil. There have been questions really of how to handle Ebola. Kerala showed a you know, it's one of the exceptional states, I think, we tried to show how you could actually, you don't need only very high-tech solutions. You could, with some preparedness, you know, learn how to handle these uncertainties. But I think my puzzle is this, that we know that to just put 2 or 3 facts on the table, and then we can elaborate that in relationship to any questions that we have. One is that whenever you look at the newspapers and whenever you look at scientists speaking, you get this kind of sense that, you know, what you get is a number, you know, large numbers are displayed, right? How many people tested positive, what is the number of new infections, what is the way, how many deaths. The fact of the matter is that we actually do not know yet how to assess what the rate of infection is. And that's partly because most of the places, people who have been tested have been symptomatic people. And this makes sense given the fact that there was a real shortage of testing kits. But you could step back and say, why was there a shortage of testing kits? Why was there a shortage of protective gear, right? Why was there a shortage of masks? Now, it's interesting to me that Johns Hopkins, my own university, has this Center for Preparedness, which has been working for years. They tried to work by first creating an index of preparedness. And you go and look at this index of preparedness, it's rather similar to the kinds of indexes which used to be prepared for things like, evaluating countries in terms of their human rights record or quality of life, which is they had 46 variables. And on each variable, they gave a particular score to a country. And then, they aggregated the scores. I mean, the problem with that was exactly the same problem as with other indexes of this kind, which was first that although it was a gigantic exercise, it was not very clear how are you going to put weights on the different variables. You can't simply do an aggregation. There's a difference between saying that in rural India, in certain parts of rural India, the number of trained providers in villages can be just one provider, right? And most of the healthcare in these areas is taken care of through semi-trained or even untrained providers. How are you going to make an assessment of healthcare in those kinds of areas? You had uncertainties around questions really about if a pandemic happens, what is going to be the spatial spread of the pandemic. So interestingly, in their ranking of countries, US came first, right, as the most prepared country. And you would say that after the pandemic, it became very clear that US was a disaster in terms of the management of the pandemic, right? And part of this was because of the unpreparedness. It didn't have even simple things like masks. It didn't have an assessment of what the hospital beds would be. It didn't have an assessment of how much protective gear would be needed. It could not test its health workers and doctors at the rate at which they should have been tested. So part of the uncertainty has been produced by the lack of preparedness. Had we the kits by which we could have actually tested, at least in areas in which there was conglomeration of people, which is, basically hospitals, nursing homes, places where people would be in contact with others, we would have had a better understanding of what the coronavirus was, and we would have been able to contain it better. But as for now, the rates of infection depend upon the fact that people who are tested are those who are symptomatic. But according to assessments, Dr. Fauci was asked what were his assessments about what's the number of asymptomatic people who may be COVID positive. And he said it could range anywhere between 25 to 50%, right? And he said, mind you, this is an estimate. I have no scientific evidence of that, right? So one is really that you have, as more people tend to get tested, we will actually have a higher infection rate. Although we will see that if you test more people, then the infection fatality ratio will actually go down, right? So part of my issue with the scientific uncertainty is the fact that we actually do not yet have an understanding of what the rate of infection is, what the rate of reproduction is. We don't understand the question really about what the case fatality ratio is because we've not tested vis-a-vis the entire population. We don't quite know even what the fatality ratio of the infected people are. We do know by now that it looks like a bipolar distribution. That is to say, people who are older, who have earlier vulnerable conditions, are more likely to fall severely sick, right? Rates of infection may very well be as high in younger populations, but rates of mortality are lower in those populations. So one is that scientific uncertainty. The second is the fact that most of the epi models, and you see the struggle, and then the fact that the Ferguson model became the dominant model, the Imperial College model. Now, what is interesting in these models is that they're basically looking at biological facts, right? They're saying there are susceptible populations, there are populations which have recovered and who presumably, have immunity, and then there's the rate of reproduction, right? In that, what you do not take into account is any kind of social factors. That's why we didn't know how to take account of the fact that a measure like a lockdown would lead to a large amount of migration of migrant labor, for instance, because a lockdown meant that they would not be able to earn their livelihood, or they wouldn't be able to pay their rent, or that they would feel that they would be much securer in their village than in the city to which they had migrated. Now, of course, population movements are being taken into account, but the fact that that none of these factors could be built into the epi models, and I'm not blaming the modelers, but I'm saying that these uncertainties should have been modeled into the idea to say, if we are making this kind of policy recommendation, these are the kind of likely fallouts that could happen, right? You could have said, well, if we make these recommendations, maybe they work for New York, because New York has been, there've been a lot of in-migration in New York. We know that in the case of New York, a number of, there were initial signs that it might actually become a hotspot after there was enough time between China, Italy, and US, for example, to be able to prepare for it, right? In India, it's sort of very interesting to see that every time the government has, there are a number of PILs, as you know probably better than me, which have gone to the Supreme Court. For example, there was an early PIL which said that there are all these migrants on the roads and government should be providing for them. The Supreme Court asked the government to make a report. The Attorney General presented a report. If you see that, you would think India has been so successful in handling the coronavirus. Well, at that time, there was no indication that India would be successful. Will it be successful all over? Kerala has been a success story. Maharashtra has not been a success story. We don't even know whether we are in the next phase or which phase of the coronavirus we are. So given those kinds of uncertainties, there's a very big question, really, of whether scientists should be speaking with the kind of certainty that they're speaking, or whether they should be experimenting with saying, look, our models tell us that these are the possibilities. These are the variations that we might want to think about. And in a democratic society, we should be having a discussion of saying which models work for which kinds of places. It's not necessary that one model would work everywhere. So given this kind of uncertainty, when new data is constantly coming in, one very big question is, can science speak in a way that its uncertainty is displayed? A lot of scientists fear, and a lot of data scientists I've been talking to, they say that if science appears to be uncertain, then people will not follow rules. And if you're curious, I can actually share with you some work that we've been doing, where it becomes very clear that ordinary people do understand that sometimes the science is not going to be very clear. What they don't understand is why there is so much uncertainty. One of the persons in the slums that I have many friends with whom I've been working, he said every time Modi goes to make an announcement, you fear that whether this is going to be like the demonetization announcement, whether it's going to be like the first lockdown, which was like, oh, we're going to do a lockdown for 2 weeks. And then, but we already suspected that it may be 2 months, right? And how to prepare for that kind of a thing would be much better if the government, in fact, took into confidence people. If the scientists said, these are the ranges of uncertainty, and within that, these are the options, and we are going to be constantly revising our options in relation to new data that comes in, right? So that is one really important question. How do we actually take scientific uncertainty into account in policy making? The second point that I tried to make in the questions that Dr. Asim Prakash asked, which is so, a lot of modelers will say, look, implementation is not our business. That's the business of the administrators or the politicians. And I think that if you have I'm not saying that the mathematics is going to be particularly easy to take this implementation into account. But for policy purposes, you would have to think that implementation is not something which will just happen in a piecemeal way. You have to have some kind of a plan as to what the consequences of a particular policy are going to be. Just to take one example, when the lockdown in Delhi was first announced, and then, when it came known that migrants were actually walking, I think there was a BBC report which then really made the government feel that they really needed to do something. And UP government announced 1,000 free buses to ply from Delhi. You had this huge crowds which gathered, right, on the bus stops, which was totally opposite to what a lockdown should have entailed, or what social distancing should have entailed. Then I think there was a PIL, and the government then said, oh, we've instructed various states to set up camps, and wherever there are migrants, they are being halted and put into camps. This is not good policy, right? Because putting them in camps really basically meant that they're gathering together over there. You're not actually ensuring social distance. So, and then, you began to get this very piecemeal thing saying, oh, we're giving free rations today. We're giving rations to people who don't have ration cards. Now we are going to be giving this money, which is going to go, provided you have the right bank account. But if you don't have the right bank account, you're not going to get it, right? So all of these, it seems to me, show a certain lack of preparedness and a certain tendency to kind of create a success story. I mean, the last example I can give you is, to me, this really incredibly difficult for me to understand why it is, let's say, ICMR actually has a recommendation saying that chloroquine should be given to health workers and nurses and contacts as a preventive measure. The study on which this was based was a French study initially, was a very small study, which tended to show that yes, giving hydrochloroquine will reduce perhaps the number of days with which you would be ill, but that if you were to if you were a patient, if you did have COVID-19, then the number of people who died as a result of being given hydrochloroquine, because it has implications for heart arrhythmia, was actually larger in the group that was being given that than in the control group, right? Although the numbers were very, very small. Now there's quite decisive evidence, and doctors are all saying very clearly, please, whatever else you do not actually give people hydrochloroquine. So these are examples in a certain sense of a certain lack of preparedness and planning, and very ad hoc decisions which are in fact being made. I think I'll maybe, so my question over here is, you talk to the data scientists and they will say, but it's not the concern of the model to be taking that into account. Whereas it seems to me that social policy should mean that we take this uncertainty, but we do some kind of an analysis of saying, how is a particular policy going to affect different kind of populations, with some sensitivity towards the fact that the most vulnerable groups which are likely to be affected by these policies are the poor. They're likely to be the migrant workers. They're likely to be people with pre-existing conditions. They're likely to be people who need regular hospital visits. For example, people with thalassemia or people with sickle cell disease who suddenly don't know where to go because the hospitals are short of staff, and they're very scared of going to hospitals. So, TB program has nearly collapsed. So the notifications have really dropped in this period. All of those things need to be thought about in relationship to public policy, and the question really of anticipating the consequences of particular policies on different kinds of heterogeneous populations. And the last point I want to make is there is considerable data in India on the kind of, we have data about because of the family health surveys, we have neighborhood by neighborhood data sometimes on the number of people who are likely to be, who have diabetes or who have hypertension. They're small samples, but they're neighborhood by neighborhood samples. So you could imagine a stratified risk approach, which is what certain other groups of scientists, which is what are called smart containment scientists, are actually trying to put together. And those are not epi-modelers, those are the economists who are doing that. So there's an interesting tension over here of how we are going to think about these different models, whether we are going to think of implementation as not exteriority to the model, but as a consequence of the model. And therefore, how should public policy be attending to these things in a mode in which the uncertainty of the unfolding of the coronavirus, which the uncertainty, I emphasize again, is partly a result of the unpreparedness of governments to be able to be ready to be researching on this. So those are the different ways in which I would say that we really need to think about this. Whereas most of the emphasis in India, of the Indian government has been to say, look, what a great success story we are. And this was exactly the same in the US. Initially, Trump was like, oh, we are totally on top of this. And it's very clear that no, we're not on top of this. And we need to be thinking very carefully because this is not the first time this is going to happen. This might, we should expect more such things to happen, both because of climate change, because of new virus mutations, because of the fact that human microbe relationships in a way are changing. So those are the observations I would put on the table, and I welcome any comments or questions.
Thank you so much. Please, is there anybody? Please raise your hands. And I've already seen questions which are in the chat. But are there any questions? Anybody wants to ask a question? Kindly raise your hand. I don't see any hands. So the first question to you is, ma'am, there's a question which says, Amrish says that, is science uncertain or the model miss some important parameters?
Could you repeat that question, please?
Is science, ma'am, should I give you a bunch of questions or should we go one by one?
It's up to you. I think I have some questions over here on the chat. And you're saying, is science uncertain or?
Or the models miss some, the scientific models, are they uncertain or they miss certain important parameters?
I mean, the point about this is precisely that it's not a question of either or. This is a new virus, right? And we have had experiences with mutations. We had in 1990s, the fact that the cholera virus mutated, right? And we had, a new strain of cholera. There was huge number of deaths in Peru, less in India, although it originated in India, right? But then it disappeared. And so there is in the history of epidemics, the fact that when new epidemics or new viruses arise, or when they are mutated, or when new superbugs arise, there is that kind of uncertainty about it. But part of that uncertainty, as I said, is produced by the fact that there was a lack of preparedness. Despite the fact that once this had happened in China, it should have been anticipated that other places have to be prepared for it, right? So that's, so there is that kind of uncertainty. There is also organizational problems, which is you would have imagined that this should have been a period of great global cooperation in science. But what you're getting is great competition. So there's a race for saying who is going to be the first country to produce a vaccine. Who's going to be, it's the same kind of competitive science that has actually made the scientific enterprise itself something much less capable of dealing with emergent issues. So imagine that if right at the start, they would have had the capacity to test much more widely, right? You would have had much less uncertainty. Right now, the biggest uncertainty comes because we actually don't know what the infection rates are. And that's because non-symptomatic people are just not being tested. And that makes sense given the shortage, right? But initially, we didn't need data to think that places where patients are going to congregate, that is hospitals, healthcare workers, nursing homes where there are configuration of a whole lot of older people and conditions are not necessarily ideal at all. It didn't require rocket science at that time to be able to say that intensive testing should be done in those places, but it was not done, right? So there is a certain failure in a certain sense of governance models in relationship to science. Add that with the fact that right now, my point is right now, we do not actually have the decisive data, which would say, we know for sure that this is the particular policy to be followed. In which case, we need to devise what kind of procedures should we follow. How might we, how would we actually manage? How would we actually manage this kind of uncertainty, right? So I'm saying, contrast this with the fact that what the government of India constantly presents in its statements is how successful they have been in managing this, right? That is a real danger, to speak much more certainly than you should be speaking at this moment. Does that answer your question?
Yeah, there's Amrish, you want to say something? And there are certain other questions. I just go to that. First, let me clarify. There is a message in the chat box that we have blocked the audios and videos and we are being undemocratic. Professor Patnaik, I'm sorry, we have not blocked anybody. We have requested everybody to voluntarily switch off their videos so that the bandwidth can be conserved. It's not, if you want, you can kindly switch on your own video and come on online if that's very important. And all of us unmute ourselves to ensure that there's no disturbance when the speaker is giving the lecture, and at the same time when you want to ask the question you can unmute yourself. Thank you, Professor Patnaik. There are few hands which I will come to them. First, there are two very interesting questions in the chat box. First is, it says that is there an incentive for the government to go for a scientific temper, because the voters don't vote because of the scientific temper, they will vote on different issues. Second, there's a question which says that what role can social scientists play in these current situation? So these are the two, I thought, of related questions. And kindly, ma'am, if you can make a note, I will request Ajit Kumar, Deepak Kumar, Hema, and Dr. H.K. Das to kindly unmute yourself and ask questions. Please be very brief. Dr. Ajit Kumar first.
So you don't want me to answer those two questions first? Which
if you prefer, you can go ahead with that first, then we can take other questions.
Okay. So very quickly, I mean, I agree that this is not a very easy thing to manage in a democracy, but it's not a particularly easy thing to manage within authoritarianism either, because, you know, the virus is not the kind of enemy you can tame with authoritarian measures, right? And so you're saying that the society people vote for, vote for other things, and I agree that there is a real dilemma over here for any government. But on the other hand, I think we must not underestimate the fact that if people are being very badly hit by the lockdown, they are going to be much more concerned with the decline in their economic certainty. They are going to be much more concerned with the fact that rates of, COVID-related mortality will go up, which is that people will be dying not because they got infected with COVID, but because the lockdowns made it impossible to, as I said, I mean, TB patients are extremely worried about this. Thalassemia patients are, their parents don't know what to do because they require regular blood transfusions to survive. So when I have discussions with people in the areas where I've been working with, what has been fascinating to me is the fact that people are trying to detect what kind of scientific uncertainties there are. For example, there's an Anganwadi worker who was very upset by the fact that she would get these, they get these messages on WhatsApp on their smartphones on what they're supposed to be doing. So she got this message to say, oh, she needed to now go house to house to see what kind of symptoms people had and whether these were COVID symptoms. But they were not provided any protective gear, not provided gloves, not provided gowns, not even flimsy protective gear. They were provided nothing, just told to go and do this house-to-house survey. There were all these great announcements of saying that the Anganwadi workers or the lower level health workers, that their salaries had gone up, ASHA workers' salaries had gone up, but actually salaries had not arrived in their banks. And so she wrote a thing saying to them, look, I mean, I'm living in a red zone. You are telling us that this is a high risk area. And then you're asking me to go house to house surveys without actually any protective gear. I'm sorry, I'm not going to obey orders in this, right? And she said something which is very commonly said, which is "Jaan hai to jahan hai," which is if you have life, then you have the world. What will I do with the job if I don't have it? If I'm not going to be able to survive. So this is the government's rendering. Often, you see the PIL, and they are constantly saying, "Well, people are given to passion, right? And because they are given to passion, we need censorship." This was in the beginning. They didn't say censorship. They said anything that is written about COVID-19 should be vetted from the government. The Supreme Court refused to give such a advisory. But the impulse to say, stop the discussion on this because people are given to passion, etc. I think that's what is really wrong over here. And so I don't think we should equate democracy with only elections. I think that democracy is also the way in which people learn how to discuss particular questions. And these things will change depending upon the experiences that people have. So yes, I agree with you that there are questions which I'm imagining many politicians will have to manage in terms of voting, but it's also important to realize that that these are not fixed subjectivities. These things change depending upon the kind of experiences that people have. Yeah, those were, and what can social sciences do? It's a very, very large question. In one way, it's interesting to see what the group in Karachi, for example, which has been working on this smart containment group, is doing, pretty fine kinds of surveys and very interesting research on questions really about how you can have a graduated kind of lockdowns rather than blunt instruments like total lockdowns. So what you need for policy is really much more variegated kind of locally specific solutions. And the success of Kerala should show us that a local model will work much better than a absolute national model in these kinds of matters. And so I think that these are all open questions in relationship to social sciences. I do see the need for data to be really, really very important. And to give you one example, there's very good research which tends to show that in the case of the earthquake in Pakistan, that although adults recovered and the infrastructure was put in place, children who at that time had to forego schooling in poor households got a real setback, so that, you know, they are following children now for several years. And what they predict is that children who were affected, particularly in households where there were no literate members, so nobody was there to actually shield them from the impact of the missed schooling in those months, are likely to carry this deficit over a long period of time, right? So the impact of what look like small, you know, short-term changes on the long-term capabilities of households, to me, is a very, very pressing issue, because it's likely to increase inequalities. And this is something we should all be extremely worried about.
Thank you, ma'am. Dr. Ajit Kumar,
Yes, yes, sir.
please be
Am I-
brief, sir.
Okay, sir. Thank you, ma'am, for bringing so many issues in limited time, ma'am. My question is very specific, ma'am, that data is always a problem. You talked about neighborhood data, and most of the developed country also, they are failing in this. So how come social scientists in India, who especially the research scholar or academicians, they will do research on this corona period? And what is your take on data accumulation and fudging of data?
You know, we can always go back and say, oh, there's fudging of data, but there are techniques for thinking about uncertainty in data, right? There are techniques like how to look at missing data. There are techniques for, even for the coronavirus, very interestingly, for COVID-19, you have pretty good questions around saying, all right, we can't say with absolute certainty what the incidence of the disease is, or, you know, how many people are infected in the population, but we can estimate upper bounds and lower bounds, right? So we can say, given a certain set of assumptions, these are likely to be the upper bounds and these are likely to be lower bounds. So simply saying that you know, the data is not fully reliable is not the end of the problem. We have had techniques for a long time on how to deal with missing data and how to deal with inconsistencies in data. I would say that the family health surveys are actually really very, very important sources of information. So when I said that we do have some idea about, you know, just to take one example, we know in terms of neighborhoods or in terms of the differences between different kinds of, say in the US, we know that the difference between different kinds of small towns and areas where there's huge in-migration versus areas in which mobility is much less, or the age structure. We know that where there is a larger number of older people, you're going to get greater risk of infection becoming much more severe. So I don't find that very general statements of the kind which say, you know, the data is unreliable. Yes, all data has a certain level of uncertainty about it, but I don't think that's the end of the story. I think one then has to say, given the kind of data, first, what new data can we generate? And second, how can we actually use this data to, in certain sense, make it usable? So when I said we do have the data on neighborhood level of existing preconditions, for example, you know, this was based upon the fact that the blood samples were taken of the sample from the sampling in the National Family Health Surveys. And using that data for what is available is actually a very much more important task than just general exhortations to say that the data is not reliable. We would have to say reliable under which assumptions, you know, what's the level of error? How can we actually deal with this error? How do we actually make up for missing data? So as an anthropologist, for example, you know, we just initiated this 10-country study about the way that households are dealing with this particular period, because we were very interested in questions not of retrospective reconstruction, but in real time, how do households manage when, for example, if for 2 weeks you've not had any money come into the household? Are you being able to take loans from the government? Are you being able to use your social networks, your kinship networks, your neighborhood networks to be able to deal with that period of uncertainty? What are people, what are mothers who are illiterate being, or who are school dropouts and who are having really major problems with the fact that they don't know how to help their children with homework, right? These are very specific nitty-gritty things which should have been part of policy, right? For example, it's a very simple policy to say if children have lost time in school, then please can we have, say, a kind of makeup of tuition centers which will cater specifically to households in which there are no members of the family who are educated enough to help the child with homework. I mean, all these seem like, and I'm sure many NGOs will come up to do that, but it seems to me that a concerted kind of thinking about who are the vulnerable groups, how are they going to be affected, is something which is very, very important for social scientists to address at this moment.
Yeah, thank you so much. Dr. Hema? Dr. Hema, could you hear us?
To me, yeah. Thank you for giving me the chance. Thank you so much, ma'am. In fact, it was a very interesting discourse and many things have added to my knowledge. My simple query is, what stand the science has on this concept of herd community? Will this herd community decrease the level of uncertainty?
So, so herd immunity is the idea, which is the old idea, which is that where you, and there was a very important paper in Science, which in the, I think, 80s, which showed that if you do get, the idea is a very simple one, that if you do get infection, you will get the fact that a certain proportion of the population will die and the others will get infected and cured, and those who get infected and cured will get something like immunity. So even if everybody is not immune, if there is 80% of the population who survives are immune or become immune, then the rest of the 20% will not get the infection because there won't be the kind of density to be able to spread that infection. There are two assumptions over there. One is that the modeling of that has been done on closed worlds. That is to say, it assumes that new people will not come in who will bring the infection into the local community. But we don't have that world anymore, right? We know that the appearance of the infection in Wuhan then led to the spread of infection in Italy, for example. It was the people who had come from, gone from Wuhan to northern Italy who brought in the infection. In other places, we know that, so global traveling is a very big thing, right? And, and that means that we actually don't have a closed world. So the idea of herd immunity doesn't work that easily. The other comparison has been made with influenza, which is to say, well, we know that the flu virus changes every year, and we manage to get vaccines every year, which have only about 30 to 40% efficacy, but which is enough to at least make, so people die of flu every year, right? But and in some ways, in aggregate numbers, the actual deaths from coronavirus and the deaths from flu might be comparable. But the reason why one cannot actually compare them is that the local concentrations are very different, right? So it's very different when you have very high infection rate, say in New York, right? Which will then overwhelm the hospitals over there. And so your preparedness has to be of a different kind. So what I'm trying to say is that the spatial geography is a really, really important geography. There are going to be some areas in which even if everybody gets infected, not many people are going to die because the population is young, because the fact that you have less pre-existing conditions and so on. The other problem with the herd immunity notion for now is that we actually don't know whether people who get infected once and show temporary immunity are going to be immune forever, right? This is going to be a big question for vaccine development, because we won't know whether the vaccine is going to be like, say, MMR, where you take one injection, one injection and then one dose, and then you take booster doses, and you have immunity for, say, 20 years or something of that kind, or whether it's going to be like flu, in which the nature of the virus will change every year, and therefore you will need to be, researching and producing vaccines every year. So I think herd immunity is a concept which comes from, earlier studies of epidemics. It's an important concept. Its assumptions of a closed world and about the idea that immunity is immunity for long period of time is very untested for. We know that it's not a small world, but there's a spatial geography to it. Some places might be modeled as small world spaces, but other spaces cannot be modeled as small world spaces. And second, we don't know whether this gives us immunity for long period of time, or whether this is short-term immunity, or whether the virus will mutate next year. Already we know that the presentation of symptoms are very different, right? It started with thinking that children don't get affected, and now a small proportion of children are infected, but with very different symptomatology. So those are precisely the kinds of questions which don't allow us to just settle very quickly on the idea of herd immunity.
Thank you so much. Thank you so much. Ma'am, should we go to the next track? I know there's a number of questions that put in the chat and otherwise, but we are just schedule. So should we go for the next track? Maybe we will try to see if we can cover some questions later.
Yeah.
Yeah. Okay.
So the next chart I want to put before you is this question of democracy and authoritarianism. This is not a new question. I think it has become a very major issue for democratic politics, right, and for democratic theory, which is that the sharp division between authoritarianism and democracy have become much less, as we are seeing that authoritarianism within democracies has been on the rise. And so this is even outside of the appearance of the pandemic. Just to give you a couple of examples about this authoritarianism to just set the stage. So we've had this enormous increase, so when certainly after September 11th, there was a kind of global discourse about security, right? And the security apparatus became a very important part of democratic governance because of the pressure to say, well, democracies need to protect their citizens against this, what was then called this new scourge of terrorism. A lot of that we know that actually is pretty complicated for the simple reason that, just to give you one statistic, the large number of people arrested under Tada, the reason why, why Tada was rescinded was that something like 80% of those who were arrested were then finally found not to have, nothing could be made to stick against them, right? And elsewhere, I've written about the fact that that a lot of the terror legislation became a certain way of, consistent harassment of Muslim communities, and the fact that for every case of terrorism, you would have very large number of arrests, which the police probably knew had nothing to do with that particular case, but they had to show that they were very active. And so it led to this very difficult question as to why is it that democracies tolerate torture. A lot of torture has been used in Indian prisons, including the fact that if you just visit police stations, you see this thing called the patta, which is which is this belt used, which is for wheat grinding machines, but which can really hurt, right? And you get this humor saying, "Meri awaaz suno," or things of that kind put on, that patta bolta hai, and so on and so forth. So already you have this kind of tendencies to which we have been blind on the name of security. Now you shift to the question of biosecurity. So is the virus similar to something like a terrorist attack? Well, at the face of it, it's not. But the kind of laws that have been used to impose things like lockdown initially were extremely draconian laws. For example, the laws of saying that you can be actually arrested for defying the orders of a public servant, right? The fact that disaster area acts, which used to say there are small areas which can be declared as disaster prone, and you can, for temporary reasons, use the Disaster Act. Now the whole of India has been declared that. So a number, if you follow the number of arrests, I think in the first month, Maharashtra, 66,000 arrests for defying the orders of public servants, or for under the Epidemiological Diseases Act, or under the Disaster Act, etc., right? Later on, it's very interesting to me to see that initial videos, if anybody has seen them, which were taken in Delhi, at least I know, by by local people on their smartphones, right? They showed the fact that you get like a person with his wife and his child who is trying to go from one place to another place, and the police will not just tell him to please go in or to please hurry up and go. As the person is going, they would hit them with their lathi, right? You can just look at all of those things posted on YouTube. This was, in a certain sense, citizen vigilance to say, look what the police are doing. The interesting thing is that it took a little while for the police to realize that that was a very dangerous practice for them. That is, you are, if the person happens to be COVID positive, you're actually bringing the infection to yourself. And so very interestingly now, over a period of time, police patrols have become lessened. Initially, if they would see a vegetable vendor, they would just upturn the cart, saying you're defying this particular order. Or, it was very common, I don't know if you know what it is, to say murga banaya, which is this kind of punishment which used to be given to school children. You have to squat and, hold your ears, and it's a very painful punishment. And certainly nowhere can you say that this is within the rules and regulations, that the police can pick up anybody, make them sit in a park and ek ghante ke liye murga banaya unko kind of, question. So there is, I think, that set of issues that the government in some ways is partly panicked, it seems to me. And as a result, the kind of, if you just look at the executive orders which kept coming, these have been very, very very contradictory sometimes. I gave you the example of saying you have a lockdown, and then next day you have the UP government announcing 1,000 free buses to take, to take workers back to their villages. And then you have an order saying, no, you have to stop them wherever they are, and they have to be put into camps. And then you have a thing saying, if you look at the PIL, it would we are doing everything. They have been put into these camps. They are given food. They are given drinking water. They have medical facilities. In case there are psychological problems, we have psychological counseling. And I was, wow, I've worked for 20 years in slums. And if you only had that in the normal circumstances, we would have had a much healthier population, right? So the fact that at one time the Supreme Court used to say, okay, we're going to make our own committee to go and look into these, right? That's how the Lunacy Act was amended into the Mental Health Act. We don't have that kind of a activist judiciary, although the record is now pretty mixed. The other very worrying things, because in India, I think this has become, it's this whole kind of stigma around saying that it's the Jamaitis which spread the disease. Certainly that congregation, as any congregation became a hotspot, but so were, the Ragi in Punjab who went to Italy to give lectures during the Sikh festival and came back and went without declaring that he'd been there, went around in different villages. They're different sorts of migrant labor has been taken that. So I think that there are these kinds of trends about authoritarianism, which need to be very clearly guarded. I mean, the kinds of court cases that have come up seem to me very ominous. There is a court case which is around the thing that asking that Muslims should not be allowed to bury their dead because that is a public health hazard. It's not a public health hazard, and the courts have rightly dismissed that. But the fact that people bring up these kinds of cases right before the court will tend to show that the kind of fault lines that have been created in this society, which is you can mobilize a lot of Hindu opinion to kind of make this idea that Muslims are the culprits, and the entire Citizenship Act, which was over which the virus came. I think all of these are signs that the authoritarianism is not going to solve the problems. It didn't solve the problem of terrorism. The kind of draconian things that have been done in Kashmir is not going to solve the problem of Kashmir. The kinds of questions which, and not only in India, I mean, China has now used this period to say that they can consolidate their authority over Hong Kong, for instance, right? Russia is a very good example in which there's been a complete denial in some ways of the actual very grievous ways in which the pandemic is affecting the populations. Chile is a very good example. It's one of the countries which we are going to be researching in. And this has come along with the protests in Chile over, over the kind of liberal reforms which have led to absolute economic devastation in places like Chile and Peru. So you do have worldwide a particular crisis around democracy to say, how are we going to be dealing with democratic governance? Already the kind of concern with security had created that. And the fact that part of the global networks of this kind of security has been that even countries which sort of pride themselves for saying, oh, we are open societies. The US is a very good example. So if the law does not permit you to do torture, in the US actually it does, right? They've been using the global networks precisely to export people to places where they can be tortured legally, right? So you need to take a holistic view of these and say, if you're giving police that kind of power and you're giving immunity in some ways, and if you're putting your army in the kind of situation in which they have to be dealing day in and day out with, with things which they cannot control, you are going to lead with extremely authoritarian measures. And the lockdown was just one instance of that, in which initially there was a lot of support for the lockdown. It began to slowly whittle away as people began to realize that it would have very disastrous consequences. So this whole thing to say, well, is this a choice between saying, ya to bhuke maro, ya virus se maro, right? So what kind of choice is that in some ways to put before people to say, well, you know, if you're not going to get food, then, you know, fine, we can give you a largesse, we can have charity, but we have no plan in some ways to see how to mitigate these kinds of circumstances. So it does seem to me that there are really, I have no answers to this, I should say straight away, because I think this is something which needs much more discussion. And most of the time, the kind of discussion on the clamping down on universities, which happened, for example, which is prior to this, right? Where if you shouted a slogan, you know, if you just said a slogan when you were protest marching and said that India has occupied Kashmir, which is, you know, could be you could contest it, you could agree with it, you could disagree with it, but you cannot say that this is an act of sedition, right? But people were arrested, FIRs were filed all over to say that this is sedition. So part of that kind of authoritarianism and clamping down upon free discussions, you know, terrorizing the media into complete compliance with the government policies, I think it's going to be a very, very difficult thing. You know, one of the persons in the slums that was a friend of mine, it was like, you know, initially when Modi had said, oh, you all need to clap and, you know, play your drums and thalis and so on and so forth in support of health workers. I mean, first this is when they had not provided any protective equipment to health workers, right? So what's the point of doing all this thali and so on and so forth when you are not doing the minimum for the health workers? But what this guy said, which was very interesting, he said, Modi ji ne kaha tha 9 minute ke liye karo. Modi ji had said for 9 minutes. Hum 1 ghante tak bajate rahe. You know, we did it for 1 hour. Second week, he's beginning to talk and saying, well, you know, we were very enthusiastic then, but now it looks like there are going to be real difficulties. We're not getting vegetables, we're not getting fruit, right? Then the decision was taken that vegetables and fruit vendors can go around, right? And I think if we survive this epidemic, it will be because the poor are extremely innovative about how they are actually trying to deal with this, but they're also not stupid fools who can just be deluded forever. I don't think that's the correct kind of version. So those are my kind of observations to say we have to think about the long-term trends in relation to the security apparatus and its use, and the fact that the virus creates new kinds of security concerns, and we have to think how these can be related in some ways to thinking not narrowly just about saying, well, you know, we needed to do this, but to think about the long-term ways in which democratic governance has been slowly eroded in the country. Yes, that's the...
Thank you, ma'am. We'll invite question. One very quick query.
Yeah.
Are these apps which has come from all over the world, are they necessary evil, or they are invasion into the privacy and the tracking of the social networks? And does it have to do anything with the authoritarian kind of things we're talking about?
Very, very good question, because, you know, you do have, so in places like China, you know, if you're doing research in China or whatever conversations you're having in China, the algorithms will be tracking you all the time. In one way, it's not different from the way that Google tracks you all the time. The difference is that Google doesn't have the power to come and arrest you, right? And disappear you because you said something about the coronavirus or about COVID-19. There are forms of censorship which are very sophisticated in places like China. I could speak more about it if anybody was interested. In the case of India, the instruments are very blunt. You know, you don't have that kind of, China combines very blunt instruments with very sophisticated, you know, forms of censorship and control. In places like the US and so on, I think that it's, you know, so simply take the fact that the rates of incarceration in the US are among the 3rd highest in the world, right? And if you look at who gets arrested, this is disproportionately African-American populations. So I don't think that this is anything like a necessary evil. So even this question of privacy, South Korea is presented as this great success story, right? Because it did not have lockdowns. It basically did contact tracing. But you have to realize that South Korea has been doing contact tracing for other kinds of things for a long time. So they have this filial piety law. So just to step back, so 29% of the population in South Korea lives in single member households, right? Why is this so? Because part of the laws have been these piety laws, which have basically said that older people are can get government subsidies provided their families are not providing for them. So they have to show that they live in single households, right? And the children are not really around. The government actually tracks their telephone conversations and has done it for a long time. You know, so then you will get a phone call saying, but we saw that you have been in touch with this person on this telephone number at least 5 times in the week for the last 3 weeks. And then we checked and it looks like he's your son. So when you said your son is not in contact with him, you were actually not telling us the truth, right? And because they had these contact mechanisms in place, that they were able to actually do that, right? So I think here again, you will have to think very carefully about certain ways in which an openness to this would be very important, which is if you are doing contact tracing, for how long are you going to keep this data? Even if you say this is necessary for, you know, for tracing contacts right now, okay, how long are you going to keep that data? Who's going to have access to that data? When is it that this data will be destroyed? So you have to think of the mechanisms which will go with it rather than thinking it's either necessary evil or not doable at all, right? And I think it's the absence of those mechanisms which is actually very worrying to me.
Dr. Ranu Jain, please. Dr. Ranu Jain.
Can you hear me?
Yeah, we can hear you.
Okay. Thank you very much, Dr. Das. It is really nice to hear from you. I was just wondering the kind of atrocities that we are seeing happening on migrant workers. They're hungry, their children are dying, they're walking barefoot. Government policies are so unkind towards them. Then why are we not seeing any rebellion in their part? Is it something to do with the repressive state apparatus? Finish the scene.
I think I would really need to, I think part of the danger is, is this very, I think we tend to talk in very general terms, like their children are dying. Actually, we don't know what the data is on that, right? I would love to see in the camps what kind of data can you produce. What kind of effects they're having. I totally agree with you that they should have been at the center of concern, given the fact that so much of the economy depends in some ways on the migrant workers and, what kind of labor they actually perform. But I do think that so the government's response has been piecemeal response, right? They have been, all these systems of food distribution by religious organizations, by governments, political parties are falling backwards to say, we are providing ration, we are providing this, we are providing that. I think the problem is that this is being presented as a largesse. Look, we have this Garib Yojana, and cash is coming into the places where there are banks, but or where people have bank accounts, which, we know from surveys that actually people's use of state mechanisms, the poor people's use of state mechanisms has gone up considerably over the last, 5-6 years, right? So you do get the fact that people used to lack documentation. Now the number of people who don't have ration cards is actually considerably lower than it was 10 years ago, right? Part of it, there's a long history of how, people began to see documentation as absolutely necessary for state claim making. So the question of why don't they rebel, I think this keeps coming up, and it's a puzzling question to me. for the reason that we actually don't know what the nature of the rebellion is. I think for a while ago, um, one of my friends who was basically past grade 8 and was a Congress Party worker, at the time of elections, he asked me and said, so what are people writing about us? And I translated, all these very big people from MIT and Harvard and so on were writing in newspapers. And I translated a lot of that and made a gist of things. And, we discussed that. And he said they've got it all wrong because they think that politicians just come over here and then they disappear. They just come to ask for votes and then they disappear. He said, we're not that stupid, that our votes can now be bought by a bottle of liquor. And he actually wrote an article for the Indian Express. He wrote it in Hindi and I translated it in English. And one of the things he said over there, and this is really quite startling, which is that the poor will go to their legislators much more than the rich will. So I began to think, yes, I never thought when I was in India that I actually can just walk into a MP's office or a MLA's office and say, my child is not getting admission. I need signature authorized, but they do it all the time. It's the bureaucrats from whom they're very, very distanced, right? So you do get, I think, in different, and this is a different spatial geography, but you do get the fact that the poor have felt that they can access the state. And part of the problems have arisen precisely because over a period of time, the sense of empowerment has been linked also with the kind of, a certain kind of popular justice. So we are so powerful, we can lynch any Muslim if he eats beef. Goes along with this question that, these legislators, we are the ones who've elected them. And so, we don't want charity from them. We want that given that we have elected them, they need to do this for the road or for sanitation or for water in the slums. So I think there's a lot of work now which tends to show that the relation to the state is much more complicated than this earlier one of that you are either simply clients of the state or you are in rebellion against the state. There is something very different, a different shift has happened. I think in the case of the pandemic, it's very hard for them to say, so provisioning has become a very, very important thing, right? But they really resent the fact that the state presents it as a largesse rather than as a consequence of their policy, and therefore the obligation in a certain sense to provide this to the poor as citizens. So I think I would reframe that question to say that, you really need to go hang out with them, in the slums, and just really just hang out and talk to them. I mean, now they are actually coming on Zoom and talking to me because their smartphones are able to, get into Zooms, and we're having these very interesting discussions about what this kind of change has meant for them, how they're coping with it, what is it that they're expecting government to do, all of which I think will be very varied across different kinds of states. And so, but I will totally agree with you that the migrant worker issue is a big, big issue because it tends to show, partly just as supply chains have been a very big issue. So you are going to think about the need of migrant workers where, let's say, the harvest season comes, right? Because you don't want food to be just, harvest to be wasted, for example. What will that mean in terms of a proper government policy is a very important thing. But I'm not sure that the direction I would go is, are they rebelling or are they being compliant? I think there is that middle thing of how they go about getting, into the state apparatus, which we need to think about more. And also the place of, the change that has happened in terms of accessibility to local MLAs, to municipal councillors, etc. It's quite an interesting change. I mean, it's not the kind of time when I was in 60s doing research in places like, UP small towns like Badauth and Baghpat. They used to tremble at the idea that they could actually go and, they would say that you have to stand 50 yards away from the voting booth because, you know, till we are giving permission to go over there. They don't have that sense anymore, which is why if you see that the poor vote much more, the numbers of poor voting is much larger than the numbers of the rich voting in India.
Yeah, thank you. So one last question in this track. Dr. Sanjay Barbora.
Yeah, thank you so much. Thank you so much, Professor Das. It was really wonderful.
Sanjay, hi.
How are you?
Yeah.
I was just reflecting on this, and I'd like your thoughts on this. The convergence of the whole counterinsurgency, logistics, and history, and the way in which quarantine is being done is really quite remarkable. It's very interesting. But unlike the 90s or even the 80s, you have the most docile population who are now subjected to this kind of violence. Any thoughts on how it's going to pan out in the future?
Can you say a little more on when you say, I mean, so we do know that the plague legislations, you know, that we know that every epidemic has led to an expansion of state power, right? The nature of the quarantine is, in different places, China had very aggressive quarantine policies, right? But they had the infrastructure to be able to make that, right? So initially only people who were testing positive were removed to hotels, or, you know, they had a lot of excess apartments because of the great growth in building activity in Wuhan. And so there were a lot of people who were moved to these places. They had the party cadres. They have, as I said, the most sophisticated surveillance system. So they actually knew how much money, you know, how much food has to be taken. They could organize party workers to deliver food, to deliver medicines, etc., etc. And so you got very strict quarantine measures, but you got these quarantine measures not by simply, you know, the state authority was very clear, but so was the very strong support to the state by the population on this, right? South Korea, the quarantine was much more in terms of the fact that you were quarantined in the home, but there were cameras, there was the, you know, like the government now has this thing of saying you should have this Arogya Setu on your cell phone so that we can track wherever you are going. And their data is very, very, you know, the data gets very muddled over here because of the fact that ownership of you know, I mean, who owns the phone and who carries the phone are people who are very, very different. And the government knows so little about how the poor live sometimes, I think, that, you know, that they end up making all those mistakes. So as far as, I think part of the problem with the way quarantine is being implemented, at least from what I've seen, is not the kind of thing which Foucault describes, which is a certain, you know, very, very strict questions about zoning. It's not the kind of way in which smallpox eradication in India was implemented. Because, you know, if you read that literature, it's a very chilling literature because all democratic rights were completely abrogated, right? You know, people could, if any case was reported, I mean, you know, you could go over there and literally seal up the place completely, or vaccines were given sometimes to people by literally tying them up and saying, no, you've got to take that vaccine. The government even and the international agencies learned that that was not the best way. And so when it came to things like polio vaccination, you already had very market strategies which were used. This particular question, partly, as I said, because there is a certain panic, there's so little which is known in decisive ways about how the coronavirus would have an impact on specific spatial geographies, that the manner in which they've gone about is to say where you get positive cases, you declare this color-coded system. And from the red zones, for example, I mean, in one of the areas in Noida where I work, something like 70 people were taken away for quarantine, right? And then there was no news about them in the locality. And that spread a lot of anxiety and danger. They were returned later, and it turned out that, you know, that the people who did test positive had very didn't have very severe cases of, of COVID. So it seems to me that unless one takes the specificities of this particular features of the coronavirus, we can't just make a judgment about quarantine, right? The quarantine has been, and the declaration of what to do with the red zones or with the hotspots has been the use of pretty blunt instruments because we know so little about it, right? And so I don't know whether that answers your question. I'm very hesitant to say we can just take history and put it over here to say this is just history repeating itself. I don't think it is. I think that there is an expansion of state power, but there's also the manner in which the fault lines, like, one of the big fears has been that people will get so scared that if they report symptoms, then the government will come and remove them. But interestingly, that has happened more, I think, with the Muslim families are very scared of this in some ways, that they're already stigmatized. And that if they report this, then, the neighborhood is watching over them and so on. So I think surveillance would have to be thought about in a different way, because surveillance is both state level surveillance, but there's also neighborhood level surveillance, which has really increased, and which, migrant workers returning to their villages have not been allowed to go straight to the home, right? They've been put into school camps or places of that kind. So I think that you need to see this question of surveillance itself in a different way than, let's say, the Foucauldian imagination, which was much more around the way in which sovereign power and biopolitical power, collaborate in the case of epidemics because of the security apparatus. I don't know whether that answers your question, but I'm very scared of the fact that people are just falling into ready-made concepts, which which are not taking into account the specificities of the kinds of uncertainties that that this particular pandemic, and not pandemics in general, have actually created.
Thank you so much for that. Ma'am, with your kind permission, we move to the track 3 because we are already running very late.
Yeah.
This is a track where we want to know about what's happening in the family domain, in the domain of the family, the kinship, and how the whole pandemic is structuring some kind of inequality there, or it has become a site for the state to operate through its own surveillance and enumerative measures.
Yeah, I mean, I think that this is again a very interesting question for me, because because we are seeing very interesting country differences in a way which I'll not go into right now because it take me too far apart. But I would say two things. One is that this is a period to think quite seriously about questions about gender and questions about intergenerational kind of justices. So a very important question is going to be not just inequalities in the population, but inequalities within the household, right? So, there are reports about gender violence having gone up, and I found it very difficult to research that because, you have, for the poor, you are living in this very crowded conditions, right? So even if you're talking on phone to them, to a woman, you can't ask the kind of questions that usual kind of surveys used to be like, have you ever been beaten up by your husband? Because people are just around, their children are around, right? And so that's going to be a difficult question to research, but I mean, certainly we are finding, say, a couple of things for your consideration. One is which kind of households are going to be able to protect the the other members of the family from the kinds of deleterious effects of things like the lockdown or the question about COVID-related mortality, right? So we really need to be very, very vigilant about thinking about excess mortality overall and not simply excess mortality from COVID-19, right? And the reason I say that is that there are very complex emotions that are involved in this question, really, because we know that with very poor families, one of the most difficult thing is that, that mothers end up they end up performing triage, right? That is to say, this thing that if everybody cannot survive, then I need to put investment in those who are more likely to survive. If everybody cannot sustain going to school, let me concentrate on the children who are more likely to be successful than the children who are less likely to be successful. So one interesting thing for the poor that we are seeing is that there is a difference between households in which there are, let's say, even one or two persons who have, something like a graduate degree. And when I say a graduate degree, they haven't gone to fancy colleges or fancy universities. They've got these by open, university, or they've sort of taken courses with different kinds of distance education. And this was always a very important source of getting education into the household. What we're seeing is that the same household will have some people who actually have these capabilities and some people who don't. So in the same generation, you might have two brothers or one brother and one sister who have a graduate degree, and then you have two who are a school dropout, and then a third who's 20-year-old but now going to school, right? What we're trying to do is to see whether so earlier when we thought about problems of externality, we used to actually think about we used to think about those who were like literate mothers as individuals were considered very important, because if you have a literate mother, you know that the children's health will be better. Now I think we need to think about the intra-household processes in a wider way, in which whether some capabilities in the household translate into better ability to survive. Yes, that's one set of questions. The second set of questions is what kind of possibilities around questions of violence against children, violence against women will surface. I think, in South Korea, again, very interesting, it was reported that violence against women went down in this area and abuse against children went up. But this is very misleading, because when women would call health lines or call the police, they would we are so tied up with looking, with regulating the entire COVID-related they didn't have lockdowns, but social distancing and looking at other complaints. We don't have actually time to register your complaints, right? So, I think this is going to be one very big issue of how exactly are we going to provide for mechanisms for redressal of increase in domestic violence. And this increase may not be in the form of severe violence, but it can be in the form of erosion of capabilities. For example, one of the women I was talking to was like, कि मेरे husband हमेशा कुछ ना कुछ तो कहते थे जिससे जलील हो जाती थी मैं, लेकिन अब बच्चों के सामने कहते हैं तो मेरे को बहुत दुख होता है इसका, right? Which is like, that she's being insulted in front of the children is something which she's finding very, very hard to bear. So I think we are going to see these changes in the textures of relationships, but we're also going to see different aspects of family, come onto the surface. For example, we're going to see whether families which have better social networks in terms of, in terms of the fact that they have more dense relatives in neighborhoods, are likely to do better than families which are much more sparse in terms of the social networks that they can actually call upon. Just to give you again, why am I saying that? Just to give you one example. So some of the families I work with have children who have thalassemia, and which means that every 2 weeks they have to be taken to the hospital, and you have to get blood donations for them because the hospitals don't allow you to give blood to the children unless you can also find somebody who is willing to donate blood. right? And now they are finding that earlier they were able to use their social networks to do that. But if the network is very small, they're finding it very hard to get somebody to come and donate blood. So we have to be, I think, pretty specific in thinking what kind of capabilities are going to be eroded and which kinds of capabilities are those in which we can put some kind of a, in which we can put some kind of buffers to be able to return back. So one major issue is going to be what's going to be government policy with regard to providing ways by which households can, poor households, vulnerable households can regain in a certain sense what they have lost in this period. So one of the biggest anxieties they have is that they were investing so much in, in the children, and that whether now the fact that the children might have lost out in terms of ability to perform in school, they might have lost out, the families may have lost out in terms of not having money to actually do tuitions for the children. They're very worried about they're very worried about the nutritional effects on some children. For example, when there is shortage of food, who is being deprived in the family? And they're quite open about it, that this is often likely to be the woman who will, who will want to provide more for her children, but this is going to be having some very serious effect. And if the main head of the earning members die, because the nature of the COVID changes, because we're now seeing that people in 40s are getting more strokes, for example. Then I think these are going to be ways in which we really have to think about different kinds of vulnerabilities, and how can you have schemes to be able to address these vulnerabilities by which short-term disadvantages don't become long-term burdens on these households.
Thank you so much. I see there are few hands which are there. Professor Pepin. Professor Pepin, could you hear us?
Can you hear me now?
Yeah.
Yeah. Good evening, Professor Asim, and good morning. Good evening, ma'am. Thank you for this emotionally engaging discourse that we are having. It has always been a pleasure to listen to you. I would like to make a statement, rather it is a kind of a reaction or a revolt to the question raised by one of the participants. Why don't the migrant workers revolt? I think that the question should be, why are we not revolting? So that should be the question, because we have sufficiently robbed of their power and right to revolt. We have reduced them to a situation wherein their survival is at stake and they cannot think of revolting at this stage. Just I wanted to make this statement now. Thank you.
Yeah. That's a really, really very powerful statement that you make. I mean, I'm not even sure that it's a question of why are we not revolting. It's a question why are we not bothered by the fact that, that we live in a society, we live in a democratic society which regularly practices torture. We live in a society where lynching has become something which is just taken for granted. We live in a society where questions really about the poor are doing everything that they can, to actually ensure that democracies work in a lot of places. I'm not saying this is always true. I mean, I'm not making some kind of very idealist picture of the poor. There are also people who can be mobilized to, to lead anti-Muslim onslaughts. But I am saying that there is a lot of sense in which we could be very grateful for the fact that the poor are invested in making democracy work, right? And so the question for me is, why is there such compliance in in the upper middle classes, among the well-off, about this absolute, business as usual in relationship to these massive violations that we have been witnessing. And, a substitution even on the part of a lot of scholars, what you get is a kind of moralism, in which if you have been able to find the right language to express indignation, that's sufficient. Whereas it seems to me that there has to be some really consistent thinking on what will make our democracy function, what will make it work, and whether, even right now, we really need to think what are the mitigating factors that we can put in place. I just gave you very quotidian examples, which are coming from what is it that they want. They would want more tuition centers, in which, given the fact that they can't afford tuition anymore, can the government, can the NGOs begin to think that children are going to be major sufferers of this, even when they survive? What is it that you can actually do for children in which they're completely invested, because they have put so many resources in very resource constrained households to be able to say our children should have a better life, right? And they were on an upward path. Surveys which we did, which said, do you think your life is better than the life that your parents live? Something like 90% would say, yes, our lives are actually better. And I think that this is going to decline now. And so, we read, that is a great observation, and something which, which I've been writing about. I hate to advertise it, but if you just look at a particular chapter in my book called Textures of the Ordinary, which is on the question about what makes a we, right? So why are we not a we with the poor rather than saying they, the poor, right? And I think that this is going to be a really important question for all of us to ponder about. Thank you for that.
Bhavesh? Bhavesh, could you hear us?
Hello. Can you hear me?
Yeah.
Can you hear me?
Yeah, please go ahead.
Thank you, ma'am, for the enlightening talk. I want to ask you how you are sensing the rise of child marriage, which UN is also speculating amidst this coronavirus. What are your takes? UN and other international agencies are also speculating the rise of child marriage after coronavirus and amidst coronavirus also. What are your takes? Thank you.
The right of child what? Sorry?
Rise of
marriages.
Child marriages.
Why would that be related to coronavirus? I
mean, because recently...
Yeah, go ahead.
Because there were several reports around 800 child marriages were prevented by police officials in India itself. And even UN is also speculating the rise of child marriage after the corona outbreak and amidst the corona outbreak also.
I would really basically say, this is the problem a lot of the time. We have very little data on these things, right? If there is, we don't even know what does rights of child marriage mean. Does it mean that parents just marry off a child, but there's no, what used to be that you do have early pledging of saying this is a marriage because they are scared that because they're scared that they will be left with the burden of looking after a sick person. I don't understand what is happening. And so, on that, I would not be, I can't speculate without actually having some data on what exactly is involved. Right?
Yeah.
Because, go ahead.
Thank you. So there's an interesting question there in the chat. What happens once the villages are again populated by people from the cities? And these were the mostly people who were from the lower caste or the lower echelons of the society. So what will happen to the caste structure and gender related violence given that there will be depletion of resources at the countryside?
It's not clear to me that, till we work out in more detail what the economic consequences will be. Like, one of the questions is going to be that if what's the kind of nature of decline? Remember that in a certain way, a lot of the food security was coming. First, the government has repeatedly said, and many economists have said this, that it's not that the government does not have food in reserves, right? So there's no immediate issue. The problem is going to be how to reach these foods if the harvests are changed. And the reforms in the agriculture sector, which have been informed, which have been initiated, are partly probably related to the fact about ensuring food security. So, so one question is going to be the question about production, but the other is going to be the question about movements. And a lot will depend upon what kind of, what kind of return to the economy is actually envisaged, right? So, we know that in some ways the decline in employment. So let me step back. What used to be, I mean, I'm seeing this in the cities, that what used to be the reason for worrying about the Indian economy, which was that so many people were in the informal sector, also means that people do have ways of innovating on this. So these linked households where some people are in the village and some people are in the city are going to be quite important in the ways in which these kinds of movements and support might happen. But on the other hand, I'm sure that this question of, when you raise these questions about caste structure, so most of the people I work with in the slums are actually lower castes, right? They are, because the slums have a sprinkling of higher castes, but typically these are different castes of Dalit communities who have come as migrants and then slowly begun to, 70% live in areas which are not authorized colonies, right? So some are recognized slums, some are completely unrecognized slums. And there have been this kind of procedures by which they have been able to settle in the city, despite the fact that legally they are, they don't have rights over those kinds of land. But it'll take me too far apart, but we have a special issue on the volatility, about questions about the poor in relationship to the state. And one interesting thing is the fact that what the line between legality and illegality is actually a very porous boundary. So I think that if you have the kind of impulse in which something like the right to life includes the obligation of the state to provide ways of being able to live, then it seems to me that the kinds of changes that were happening in the urban areas, at least, might not be reversed. I'm giving an optimistic picture over here, and not because, not because somehow we have a very enlightened government, but because, as I said earlier, the poor are very invested in the question of a future in which the older fault lines can be more erased, right? So it's quite interesting to see these surveys which were done by Dalits themselves, which they designed and they implemented. And part of it was this sense that their lives were better than the lives of their parents for reasons which we may think are trivial. They would say things like, when invited, we don't have to sit in this pankti, that is, we are not made to sit separately. We can go into any shop and buy Colgate. We don't have to depend upon Datum. Now, you may say, why are these so important? But we would have to be very attentive to the question of how they are trying to actually formulate their own future. And there it seems to me that, a lot of work needs to be done in the very immediate future around this set of questions.
Thank you so much. If you permit, we can take a last question and then we can close the session. Could you hear me? Hello. I'm saying that if it's fine, we can take one last question and then we close the session. Deepak, am I audible? Arvind, am I audible?
You are audible, sir.
Okay. Deepak, please go ahead with your question. Mr. Deepak Kumar Verma. Mr. Deepak Kumar Verma. I don't think he can hear me. Ma'am, can you hear me?
I can hear you, yes.
Okay, ma'am. So, okay, just one last I'm curious about one question, and then we can call it a day. And what happens to discipline-less anthropology now?
I'm glad you came to that question. You know, there are differences of opinion. First, anthropology is not a single discipline. You know, it is actually many disciplines in different places. So there are those who are like saying that, oh, you know, anthropology has so much to offer. So their concern is how do we protect anthropology?
Yeah.
My concern is a very different kind. I'm not somebody who really feels very proprietary about disciplinary knowledge. I think this is a period when we have to think what can anthropology offer to, you know, our concern should not be how do we protect anthropology. It should be how do we actually rise to the fact that you saw that I said, like, you know, when you ask me this question of what's going to happen to the caste structure in rural areas, I mean, my frank answer is I actually don't know, right? Because I would really like this to be a very important question. Which comes up for research in the coming years. I've been watching in urban areas that, you know, that the slum dwellers who all come from the very low caste have been able to create relations with the state. They've been able to do some state claiming. They've been able to use legal mechanisms. There are local institutions which have arisen where their investment in the future is strongly tied with their notion that the democracy should deliver this to them and that they will make it deliver, right? We don't realize how grateful we should be for every case that they go and file in a legal court, you know, which challenges our notion of what democratic participation might actually mean. We don't realize why local MLAs feel that their offices have to be in the slums and that every day they have to be available from this hour to this hour for people to come in. I don't know what will happen in, you know, to these openings. I'm very terrified that if the, you know, that if the kind of aspirational efforts that they were making, if they lose that and then it becomes like, you know, there's really no hope. I don't know what would happen in that kind of context. It does terrify me. So disciplinary anthropology would have to take their cues from what the world throws at us, not what we throw at the world, right? So it's not really whether our concepts work. I mean, you know, so a lot of the time, you know, we already know what we are going to ask, right? We already know that, you know, this is going to be, gender violence is going to go up. Maybe, but we need to know how, or how do we actually research that? So I think that they are really very, in the sense that whether the earlier ways of thinking about it will work, whether something new is happening, whether the pandemic has made relationships more fraught or have they made them easier, you know, et cetera, et cetera. I think that they're going to be, you know, really, and I do think that, say, something like the feminist work that was done on things like violence, on rape, et cetera, has been very, very important in the way in which we now think about gender violence as compared to how we thought about it in, say, the 70s, right? And so I think part of the question for me is that whether the discipline is something one will want to be invested in, right? It will depend on whether it can actually respond to these questions or whether it's satisfied by just performing a certain kind of radicalness, by being able to get the right words and the right tone of indignation, but that doesn't require you to go out and, you know, and actually be with people with whom you are trying to do this research. And also, I think this is a period where we have to say, how do we learn from other disciplines, right? And also how other disciplines respond to us. What are the demands we can make of them? What are the demands they can make of us? So I'm not one of those who feels that, that if we don't protect our disciplines, or our sub-disciplines, our jobs will disappear. I think that our work should be much more into saying, how do we actually respond to the questions? And I've said this for a long time. I had a blog article called "Where is Democracy in India?" which was a response to the vernacular literature which was coming out around questions of torture. To which I felt that somehow very few, there's Professor Uday Singh, there's Lokanita, who've been responding, and lawyers have been responding to this question, and some activists have been responding to this question in very, very creditable and very important ways. I don't see that kind of a question as somehow bothering very many people. And that is what we really need to rethink more. I'm sorry, I can't give a more enlightened response.
Yeah, that's kind enough. Yeah. So with this, thank you so much, Professor Das, for a very, very good enlightening evening. We had range of topics and themes which you have addressed to. I'm not trying to summarize any of them because they're very nuanced, complex, as well as they have galvanized the imagination. So that's very kind of you to be here early in the morning. And sorry for calling you every in the late night or early morning to just because of my nervousness, because I was on time, whether the communication is through or not. Sorry about that. Thank you all the participants for being here. It was a very good number, very good number. The questions were very insightful. I am particularly sorry if I am not able to navigate all your questions to Professor Das. I was trying to pick up the questions which were actually close to what she's trying to speak on. And I know you have so many questions which she can answer, but we will try to forward her on the email. We have copied all the answers. If she will have time, and there are lots of ifs and buts, she might respond to them. And thank you so much all for being here. Thanks to all the Perspective team, Arvind, Devansh, Devarati, and everybody at the back room for organizing this. And with this, ma'am, again, it's an honor to host you. And thank you so much for this.
Thank you very much.
Okay.